From Center City in Philadelphia, this is Fox 29 News at 5.
More hope for breast cancer patients who caught the disease early. It's a treatment that might reduce the number of times they have to have surgery, and it's happening right here in our area. Our Joyce Evans joins us now, and Joyce, this is big news.
Lucy, it is big news for a lot of people. It's a device designed to help breast cancer surgeons determine if they got it all while they're still in the operating room. The FDA approved the MarginProbe a few years ago, and now one local surgeon says it's helping to cut down anxiety and restore all kinds of confidence after surgery.
Confident but nervous.
A little bit of nervous laughter from Paulette Hess, prepping for a lumpectomy on her right breast. Same cancer surgery she had on her left side 13 years ago by the same surgeon.
2005, when I had the first lumpectomy done, I actually did have to come back a second time and get the surgery again to take a wider margin.
But hopefully, in 2018, I can have her surgery done in one procedure rather than two.
How does she plan to do that?
I push it into the tissue. There's a vacuum kind of device.
Dr. Jenn Simmons, chief of breast surgery at Einstein Medical Center, Montgomery,
Press it against the tumor.
shows Paulette a tool she's using, not available 13 years ago, MarginProbe.
What I do is I put it all around the specimen.
It's designed to test the margin of breast tissue removed surrounding the cancerous tumor to see if it indicates normal or abnormal.
And then I go back in afterwards and I take more tissue in the area where it was abnormal.
Right there in the operating room while the patient is still on the table, before reconstructive surgery is completed and before the specimen is sent to the lab, hopefully avoiding weeks of worrying about what test results will show.
By having to come back again, that delayed starting the treatment.
So besides that delay, it's just the emotional devastation of thinking that you were done that part and having to start over again. You want to do it right the first time.
Dr. Simmons says she's been able to cut her return surgeries by more than half, saving patients thousands of dollars, in addition to the emotional strain and the physical scarring.
So that's a significant difference.
Still, not every surgeon is on board with MarginProbe. Reports showing they want a bit more long-term evidence that it works well enough. Dr. Simmons agrees the priority is saving lives, but says for women, what can be preserved matters too.
About 30% of my patients, at the time of their cancer surgery, they'll get a lift, they'll get a reduction.
All right, my dear, I'll see you soon.
Okay.
And I don't want it to be a constant reminder of the fact that you had breast cancer. I want people to get treated for breast cancer and move on to the rest of their lives.
And Dr. Simmons says the extra procedure adds only a few minutes onto the surgery, even if she has to go back and take some more of the tissue. And she says it's no added cost on the patient's bill. We understand that Miss Paulette is doing very well, Lucy.
Well, that is wonderful to hear. Thank you, Joyce.